So we get a lot of questions from patients about CO2 ablations for facial conditions such as acne or scars and textures of the skin. And it turns out the CO2 laser is probably one of the best lasers to treat that. The difference really just simply lies in how much energy or heat you're providing to the skin surface, how deep you're going to make it penetrate, and how hot it gets, okay? So real difference between them. The traditional CO2 laser that you've heard of in the past was a total reconditioning or resurfacing laser. So it didn't leave any normal skin anywhere in the treatment area, just covered the entire thing, and it would go very deep into all of the superficial layers down to the dermis. It's a very intense treatment. It takes quite a bit of time to recover, probably a minimum of 2 weeks. There's a little higher risk with it because that's your barrier against infection, and of course that's now open, so you have to be careful. It also in some people will cause hyperpigmentation as it heals. It's very, very painful to the point where usually it's done under general anesthesia, okay? Most med spas like ours don't do that degree of treatment, but fortunately for all of us, they developed a different kind of a laser, and this one is called a fractional CO2 laser, which is what we keep in our spa. Is it less effective? Not at all. In fact, really, it has settings, and you can make those settings as high or as low as it's appropriate. So it really, a lot of it is your user knowledge that really makes the difference for you. However, the basic difference is that with the total ablation, there are no little spaces of cell or skin that are spared. It all gets treated. But if you look at the pattern made here by a fractional laser, you can see that there's a series of dots that can be very tight together and almost like a total ablation, or you can make them a little bit more spaced out, and each dot is where the laser hits and destroys those top layers. But in between, there's about 1 millimeter of normal skin that is left purposely. And the reason for that is that it's very much more tolerable. Topical anesthesia usually helps us. The recovery time is much shorter. We're probably looking at maybe 3 to 5 days rather than 2 weeks or longer. The results are extremely good, and in fact, some people feel that this might work even better because by leaving those little islands of skin of normal tissue, they make things heal incredibly faster. It's really not an inferior treatment necessarily. We just have to decide, how much energy do you need there? What are we treating? And to what length do we want to go to achieve that result?